talk a little bit about the effort put forth by hospital employees in general over the last few months?
The best way to describe the effort put forth by the Glens Falls Hospital employees. I think you can see it's been definitely a challenging few months.
When the COVID pandemic started, it was pretty clear from places where, we had learned things before that this was going to happen fast and it was very contagious. So there was a big, push to be ready for these patients even before they walked in.
So the Johns Hopkins had created this really amazing website. They were tracking in real time the outbreak as it occurred. And as soon as I learned about this website, which was, I think, the third week of January, I saved it as an icon on my desktop, and it was a permanent member of my background on my computer. So whether I was walking through the hallways with my laptop or sitting at my desktop, I had a hand on the pulse, so to say, of what's going on, how close to home it's coming, how soon we really needed to be prepared.
Before there were even any cases stateside, it was very well known via media that critical care beds, intensive care unit beds, were the beds that were going to be needed. These patients, the COVID positive patients, needed to be placed on mechanical ventilation, often very quickly. And they required a high level of nursing care as well. We spent a great deal of time in the ICU. Again, training nurses from interventional radiology, cath lab, the recovery room, all these different, areas in the hospital. So people were ready to support the critical care unit, which was, it turned out to be very important in us being able to meet the care needs of our COVID patients.
And when you're talking about a pandemic and what we were seeing on the news and what was happening in New York City, that meant a huge effort on our part to make sure that we had the space available, the appropriate equipment, including ventilators, to be able to support those that were critically ill and needing that mechanical ventilation.
Well, we always keep a running total on how many ventilators we have and what each of the capabilities are. We then were looking at, okay, the government was saying we needed basically twice the amount of what we had. So we reached out, we worked in anesthesia, because when people go into surgeries, they're put on anesthesia machines, which are in fact ventilators that are used in the operating rooms. So we worked in anesthesia to train all of our respiratory therapists to be able to use those machines in the event of a massive surge or a massive shortage. And then some other machines that are called BiPAPs, we did research and found we can actually convert those into other ventilators, and that's how we more than doubled the capacity of the ventilators we had.
We put together a very structured command center, and that command center was the information hub for any directives that were coming out of the state, the collaboration that was happening among local hospitals and other community agencies. We quickly had to mobilize teams of people to accomplish the testing and also the segregation of patients as they arrived at the hospital, to make sure that we kept our staff safe and we prevented transmission patient to patient as well as patient to staff.
And that involved really going outside the usual boundaries of really taking care of everything within one department, meaning a cardiology decision was not purely just a cardiology decision anymore, but it was one that would impact several different services. An ICU team decision would affect the cardiology team and the medical team. The ER's decision would affect everybody downstream in the hospital.
We have an obligation to take care of patients, certainly, but we also have an obligation to care first for ourselves, because if we're sick, we can't take care of others. And obviously, there was also a concern that if the caregivers became sick here at work, they could take it home and infect their family, and from there spread out through the community as well. Lots of effort was directed at making sure that we had the proper protective gear, PPE it's called, masks, gowns, gloves, shields, protocols. All of those things developed over time as everybody learned what was available and what was best practice.
And one of the ways that at least we believe to limit the spread was really to limit the number of people interacting with either patients under investigation or COVID positive patients. So the hospital had a dedicated unit that the COVID positive patients were taken care of. And they also had dedicated rooms in the ICU if they required the ICU. And we would have one, sometimes it was a physician assistant, sometimes it was a physician that was assigned for usually about a period of a week to take care of the COVID patients.
We decided that one of our existing units that had been closed previously would be a good spot to localize the patients, keep them in a central location. We didn't know how many patients we were going to have. We didn't know how busy or not busy we were going to be. I think at every meeting and every video conference and everything that we did, everybody was just like, how can we help? You know, we all banded together to try and do whatever it took to get the hospital and get the community through this unknown. And at that point, you know, they asked me and I said yes. Whatever we needed, I'm there to do it. That's my job.
So I had gotten a call from our lab on my cell phone. I was on call, and they had said, we have a positive case. It's admitted in-house. And it was one of those situations where you kind of go, but at the same time, at this point, we were almost 2 months into preparation. So in equal time step of going, you go, okay, that's okay. We're ready for this.
These patients required a different level of isolation than every other patient. So there's that protective PPE that needs to be worn, obviously, in every room.
Before a nurse enters one of our COVID positive patient rooms, the nurse would have to wear a gown, gloves, an N95 mask, a face shield, and a hair bonnet to protect all exposed skin areas.
The rooms, because they're negative pressure, everything's closed and it's just hot in the rooms. You have the ventilators going and all of the other technology and stuff which emits heat. So I would say some of those rooms are probably like 75 degrees, and then when you're in that gear for that long, it's rough. It really is.
I would say on average, a nurse would have to change their personal protective equipment 15, 20 times a day, just to provide appropriate care for each of their patients.
The illness COVID-19 is unlike anything that we've ever seen before in the world of medicine. We haven't even seen all of the complications in our emergency department, only because we haven't seen thousands and thousands of patients. But we have seen from pulmonary emboli, so blood clots inside the lungs. We've seen respiratory failure from the viral pneumonia that I think got the most media. We have seen other organ inflammation like pancreatitis, all caused by COVID-19.
One of the biggest differences with the COVID patients opposed to other patients is the COVID patient, their lungs will become a lot stiff. So think of as we breathe in, our lungs expand, and then exhaling or breathing out is very passive. The lungs would just recoil and let the air out. With these COVID patients, their lungs were so stiff, it was like trying to ventilate a stone. The lungs really didn't expand. It was almost like they were suffocating.
Once they got on the breathing machine, people didn't always do as well as they might have with other infections, which we didn't have a good reason for, and I'm sure more data will come out over time. So then it sort of progressed to, we need to be very careful on who we, put on the breathing machine. But then the other part, I think, which was probably the most important, but also the most difficult topic, was once you get on the breathing machine, mechanical ventilation, the odds of coming off is not great. And we really needed to talk to the patients and talk to families, which was difficult because they weren't there, and get some type of informed consent of, listen, this is an option, but this may not be the option that you want.
So we've had patients come in and they're on the ventilator for 10 days and then they seem to be doing great. And then we have some that are on the ventilator and we try to only keep them on the ventilator for 2 weeks. So, if we can, we try to extubate them and then they end up back on it. And it's just, I think that's the scary part. We've seen people come in and just go into like respiratory failure right away. It's like this whole array of things that happen very quickly and you never know which one's gonna.
This was a virus that took us by storm. Our bodies were not prepared for it.
As a department, we really early on wanted to learn, as this was evolving, what did we need to have available to care for patients that may present with this particular disease state. We knew that there were some classes of drugs, such as the remdesivir, which is still is being used under emergency use authorization. So we had advocated for the community in making sure that we had access to that clinical trial. We have an institutional review board that we could access to make a study available to us. So we coordinated with our team and began inquiring to the different websites for access for these things early on. And we'd almost given up on the remdesivir, and quite frankly, Dr. Fritz and I asked our antimicrobial stewardship pharmacist, Dr. Pearsall, to just submit one more time, and that was the time that we were actually accepted to be entered into the trial.
So once the pandemic started, the laboratory was very, shall I say, progressive in looking at what different methods of testing might be available. When the pandemic started, there was no testing. So as we identified that this was truly a problem, we looked at the instrumentation that we already had available to us, and were at the forefront of requesting reagent once it became available. We were waiting at the shipping dock to get it so that we could do the initial validation process, which is just to confirm that the testing is working appropriately. Positives are testing positives, negatives are testing negatives. So that was the most exciting thing, to know that we could offer that test in-house.
Some of the GI conditions associated with these patients required CAT scans of their abdomens, and typically we scan to the diaphragm, but our radiologists and our technologists decided to start scanning from further up in the chest, and the lung infiltrates associated with COVID-19 show up a certain way. And even though these patients weren't suspected to be COVID patients, those CAT scans actually identified some of the patients that now became a person of interest and were tested for COVID, and some of them turned out to be positive. So we were able to catch those a little bit earlier, and it was interesting. We started this early on in the process, and several weeks later I saw an article, research paper, on how other places were starting to do this too. So we were very proactive in that process.
On a day-to-day basis, I typically, most of my duties are all centered around elective surgery for the orthopedic division here at the hospital. My role quickly changed into working on different projects to prepare for COVID. One of those projects being the hospital's concern that we were going to run out of personal protective equipment. And not just our hospital, but many hospitals. And so I worked directly with the director of anesthesia here at the hospital, Dr. Ben Reef, And we did some research and created a UV room so that we could reprocess N95 masks. Then we worked directly with facilities here at the hospital, and they set up the grid.
These are the masks that everybody was having a real difficult time getting access to for healthcare needs during the COVID crisis. We took these masks and we developed a UVC light room that actually sanitizes the mask by allowing UVC light to hit both sides of this mask so that it could be used multiple times and addressed to a name on the mask, so that way it goes back to the same user. When we developed the N95 room, we were one of the first ones in the whole country to be able to put this technology into play. We actually took a room that was a giant storage room, and we had that emptied and constructed, and we had the UVC lighting system up and ready to go within 2 days.
And at this point, we've processed thousands of masks so that the hospital didn't run out, and actually ended up saving some money in the process, which is always good.
Glens Falls Hospital is a fairly small community hospital, and yet some of the innovations and treatment modalities that were employed here were on the cutting edge. We were in front of some of the larger hospitals in our region in getting the plasma transfer process in place for our patients.
Convalescent plasma comes from a patient that has tested COVID positive and has produced antibodies. So the thought process is, if they donate their plasma, we can then administer it to a patient and help them fight this off quicker.
I talked to my blood bank supervisor and I said, this is coming. Do whatever you can, research it, find out all of the information that you can, because I want to be prepared. And we had that conversation on Monday, and I believe on Friday we got our first request.
We had a patient that came in and very quickly decompensated, came into the intensive care unit and was not doing well. So the family was great at being an advocate and researching every possible treatment, for this patient, and reached out to us about convalescent plasma therapy.
We contacted the Mayo Clinic, who was the IRB essentially for this study. They got approval from them to be part of the study and got an identification number for our patient to participate. And then we worked with the American Red Cross to secure an appropriate donor.
That was an extraordinary effort that brought together pharmacy, medical teams, the intensivists, again, respiratory therapy doing that support, blood bank personnel, regional folks volunteering to say, test me, I may have the antibodies that can save somebody's life, the blood bank team, and the family working as advocates for the patient. The only reason why that person made it out of the hospital is because of that unification of purpose, that sense of teamwork.
Eventually, this patient got better, well enough to go to our 3 North unit. So the patient has already developed a relationship with the critical care nurses and the physicians and intensivists in the critical care. And then they developed a relationship with the nurses on 3 North and the physicians who attended there, and the respiratory therapists and physical therapy and everything and everyone involved in his care. And when it was time for him to go home with his family, we made sure everybody who was involved in his care was aware that he was leaving. The line of people 6 feet apart down the hall, all the way to the exit, clapping as he was leaving, really showed how many lives he's touched.
And it was by a suggestion of one of our nurses that we consider having a song played when the patient left the building. So we quickly put that out to vote to all of our nursing staff, and we put a few songs out there. And the winning song was Here Comes the Sun by the Beatles. And so now every time we discharge a patient who has been admitted with a COVID positive diagnosis, they hear that song on their way out.
The COVID patients were, at least in my experience, they went through something completely different than I've seen in my history as a physician. Probably the biggest part was they were isolated from their families.
We did what we could to make sure that patients had regular contact with their loved ones, and initiated many times those FaceTime calls with the family. I saw some examples of, surprise birthday celebrations and calls that really were important to keeping people connected. And it also involved end-of-life moments where, unfortunately, because of the risk to everyone, the community and our staff, we could not allow families to come in even when a patient was taking their last breath. And we had nurses who were there to, hold the hands and hold the patient and make sure that the family knew that their loved one was passing peacefully and with comfort.
And there was a woman whose husband was in the ICU, and she was understandably petrified. And we weren't able to let her in at that time to see her husband for fears that he might be COVID positive. We did not yet have the results of that test. And I just will never forget the look on her face and the way that she was pleading with us to be able to connect with her husband. She said, "He's all I have," So we quickly set about getting in touch with our IT department and said, "Hey, can you quickly put something together? Can you figure out a way to get 2 iPads set up?" Because she didn't have the technology on her own. "Can we get 2 iPads set up? Can we get some sort of meeting right now?" We set her up at a table, and on the other end in the ICU was our nurse manager, Allison, who had completely donned everything that she needed for her personal protection. She was, every precaution was taken. And she went into the room and she held the iPad up to him. He was sedated, he couldn't speak. And I listened as she sat there and had, honestly, a very intimate conversation with him about how much she needed him to get better and needed him to pull through. And she was there for him and she loved him. And I believe that in that moment she felt she was able to get that to him, even though they were separated by a screen.
When the government decided that we needed to close down and focus only on the COVID patients and those can't be delayed emergencies, it was cutting off the hospital's lifeblood. It wasn't just us, it was all over the state, all over the country. But the impact for a community hospital like ours is extraordinary.
There were a lot of bad days. In those 3 months, but maybe the low point for me was the day that we had to furlough 366 of our team members because we didn't have any work for them. All elective surgeries, all elective procedures, all ambulatory procedures, all ambulatory services, everything was shut down. And ambulatory revenue for us is about close to 70% of our total revenues. It has impacted Glens Falls Hospital through the months of March and April by almost $20 million in lost revenues because we weren't able to do surgeries, perform heart caths, interventional radiology procedures, physical therapy, breast center procedures, any radiology procedures. We pretty much were shut down.
But our board and our senior leadership said, this is why we're here, and they found ways to make do. The red ink accumulated, and we prepared and held our breath for the day when we can open the doors and bring people back in and do it safely. And it's a wonderful thing now to have the hallways not echo from loneliness and nobody being there to the sound of people here and progressing on their way back to recovery.
I am so proud of what the people in this hospital did. The medical staff, the nursing staff, the clinical staff, ancillary staff, everybody all together. I mean, the facility folks, security, people just coalesced to take care of this community.
Every employee here has rolled up their sleeves, has worked hours that they typically don't work, has kind of gone beyond the boundaries of their department to do what is right for the patients and for the community.
There were people who were professionals trained in one area who voluntarily cross-trained. In other words, they learned new skills when others weren't available so that they could step in and do the job so that people were properly taken care of.
That type of collaboration, even made me feel like I'm not alone in this. Those are the times that really came through. Everybody just coming up with different ideas or just really everybody giving their all.
People said, count me in. I'll be the nurse. I'll do the surgery. I'll give the respiratory care where I'm going to give you something to help you breathe, but the virus will be out in the air and I can breathe it. I'll do the intubation. I'm going to put that breathing tube in you so that your life may be saved, but by doing that, I'm going right where it lives. That's an extraordinary thing.
It's like being a parent. You don't question, doing what you need to do to protect your children. I think most people in healthcare are the same way. We just have lots of kids, and we really want to take care of our communities, and we want to take care of our patients. So it's good to see, and it happens at every level. It's not just the doctors or even the nurses. It's the doctors, the nurses, the aides, the assistants, the cafeteria workers. They all really come together to kind of for the greater good of our patient community.
Just complete and utter focus on the mission, head down, moving fast, everybody in the organization trying to respond to the pandemic, preparing what we needed to prepare to be able to take care of our community, watching heroes perform unbelievably every day.
The support from our community was overwhelming. From the very first days, messages of thanks and hope and concern for our nursing and our clinical staff. And that meant so much to the staff. To know that the community was rallying behind them, as they were working hard and, facing their own fears.
The support that the hospital has gotten from its community has really been part of the medicine I think that we needed to keep us going.
But the community has been just amazing with the food donations. I was responsible for collecting those on a daily basis, and the amount of food that came into this organization was just remarkable. The parades, the letters from children.
I just think it's absolutely amazing and wonderful, and I think that really helps our staff keep going every day to get through this.
There was an elderly couple that drove by, and they came up to the ED, and they had like $200 worth of gift certificates for area restaurants, and they said, hey, we can't go on vacation. This would have been our spending money. Here, you take this. And people didn't want to do that, but it was like, no, we want you to have it.
I think we have one of the best staffs out of any hospital. It's great to see the community stand behind it and prop it up, and really appreciate the healthcare workers that come to work for them every day.
People love to interact with one another, and this was a time when we couldn't interact, but it was so important that we could let each other know that we cared about one another. And I think the community let us know that they cared about us, just as we made sure that everything was there for the community should they need us and entrust their care with us. It was really, it's the irony of it. You had to stay apart, but yet it brought us closer together.
One of the most memorable days for me in this whole process was the day of the parade, and the timing couldn't have been better. I mean, we'd been dealing with it for about 3 or 4 weeks, if I recall correctly, and going through all that chaos in the beginning. And what the community, I don't think realizes that, they were coming to us all the emergency vehicles, and then car after car after car was amazing. And they're coming to thank us, but I don't think they realize how thankful we were and how much of an inspiration it was.
And I went out there, and I'm not much of a crier, but I cried when I saw those cars coming by.
I get goosebumps thinking about it because it's amazing that the community was also feeling the heaviness of this, and some people, were laid off and they were dealing with their own childcare issues and stuff at home, and just to come together and support us during this while they're probably dealing with their own stuff it's really humbling.
So one of the most touched me, moved me, it was coming up the hill from the back parking lot. I don't know who had written it, and it rained the next day, but they had chalked out "thank you" as I walked up the hill, and I knew it would be okay.